Hello everyone, welcome to my another video. Today we discuss about special MCQ for upcoming NORCET 2023. This is part 4. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 31. A client has corrective surgery for a bladder laceration. What nursing intervention takes priority during this client's post-operative period? Option A, turning frequently. Option B, raising side rails on the bed. C, providing range of motion exercises. D, massaging the back 3 times a day. Right answer is option A, turning frequently. Frequent position changes are important to ensure urinary drainage. Gravity promotes the flow, which prevents obstruction. Next question. After abdominal surgery, a client reports pain. What action should the nurse take first? Option A, reposition the client. B, obtain the client's vital signs. C, administer the prescribed analgesic. D, determine the characteristics of the pain. Right answer is option D, determine the characteristics of the pain. The exact nature of the pain must be determined to distinguish whether or not it is a result of the surgery. Other options should be done later. The first section is to determine the cause of the pain. Next question. Which action should the nurse take when caring for a client with malaria? Option A, institute seizure precautions. B, prepare for blood transfusion. C, maintain isolation precautions. D, provide nutrition between paroxysms. Right answer is provide nutrition between paroxysms. This is option D. Maintaining adequate nutritional and fluid balance is essential to life and must be accomplished during periods when intestinal motility is not excessive so that absorption can occur. Although shaking chills may occur, seizures generally do not occur in malaria. Blood transfusion are not used in the treatment of malaria. And option C is unnecessary. Infection can occur only through direct serum contact or a bite from an infected Anopheles mosquito. Next question. A nurse is caring for a client who is HIV positive. For which complication associated with this diagnosis is it most important for the nurse to teach prevention strategies? Option A, infection. B, depression. C, social isolation. D, Kaposi sarcoma. Right answer is option A, infection. The client has a weakened immune response. Instructions regarding rest, nutrition, and avoidance of unnecessary exposure to people with infections help reduce the risk of infection. Clients can be taught cognitive strategies to cope with depression, but the strategies will not prevent depression. And the client may experience social isolation as a result of society's fear and misconceptions. So these are beyond the client's control. And although Kaposi sarcoma is related to HIV infection, there is no specific measures to prevent its occurrence. Next question. In a client receiving chemotherapy, Antibiotic was also prescribed. Which tissue is affected by chemotherapy? Option A, liver, B, blood, C, bone marrow, D, lymph nodes. Right answer is option C, bone marrow. Prolonged chemotherapy may slow production of leukocytes in bone marrow, thus suppressing the immune system. Antibiotics may be required to help counter infections that the body can no longer handle easily. Next question. Aspirin is prescribed for a client with rheumatoid arthritis. Which clinical indicators of aspirin toxicity should the nurse teach the client to report? Option A, nausea, B, joint pain, C, blood in the stool, D, increased urine output. Right answer is option C, blood in the stool. Blood in stool indicates gastrointestinal irritation. It may also have resulted from aspirin's anticoagulant effect. Nausea is a common side effect. It can be diminished by administering the drug with food or using an enteric-coated product. Joint pain and increased urine output is not a symptom of aspirin toxicity. Next question. Which test result should a nurse review to determine if the antibiotic prescribed for the client will be effective? Option A, serologic test, B, sensitivity test, C, sedimentation rate, D, none of the above. Right answer is option B, sensitivity test. Infected body fluids are tested to determine the antibiotics to which the organism is particularly sensitive or resistant. Next question. What information should the nurse include when teaching a client about Antacid tablets? Option A, take them at 4-hour intervals. B, take them 1 hour before meals. C, they are as effective as the liquid forms. D, they interfere with the absorption of other drugs. Right answer is option D, they interfere with the absorption of other drugs. Antacids interfere with absorption of other drugs such as anticholinergics, barbiturates, some antibiotics and cardiac drugs. And antacid tablets may be taken as frequently as every 1 to 2 hours without adverse effects. And antacids should be given 1 or 2 hours after meals and at bedtime. Liquid antacids have a faster onset of action than antacid tablets. Next question. Which of the following drug is contraindicated when taking warfarin? Option A, ferrous sulfate, B, acetyl salicylic acid, C, atenolol, D, chlorpromazine. Right answer is option B, acetyl salicylic acid. Acetyl salicylic acid, that is aspirin, can cause decreased platelet aggregation, increasing the risk for undesired bleeding that may occur with administration of anticoagulants. Ferrous sulfate does not affect warfarin. It is used for RBC synthesis. Atenolol is a beta blocker that reduces blood pressure. It does not affect bleeding. And chlorpromazine is a neuroleptic that does not affect bleeding. Next question. A nurse is caring for a client with a diagnosis of chronic kidney failure who has just been told by the healthcare provider that hemodialysis is necessary. Which clinical manifestation indicates the need for hemodialysis? Option A, ascites, B, acidosis, C, hypertension, D, hyperkalemia. Right answer is option D, hyperkalemia. Protein breakdown liberates cellular potassium ions, leading to hyperkalemia, which can cause a cardiac dysrhythmia and standstill. The failure of the kidneys to maintain a balance of potassium is one of the main indications of dialysis. Ascites occurs in liver disease and is not an indication for dialysis. Dialysis is not the usual treatment for acidosis. Usually this responds to administration of alkaline drugs. And dialysis is not a treatment for hypertension. This is usually controlled by antihypertensive medication and diet. So this is the today's video. Thank you so much for watching my video.